And since we are a quorum, let me get started so that we don't unnecessarily run later than we have to. So this is the Gloucester Board of Health meeting of June 2nd. It is approximately 5:30. And this is a remote meeting, and it is being held in pursuant of Section 20 of Chapter 20 of the Acts of 2021. The meeting is being recorded by video and audio in accordance with the state open meeting law. The public may not physically attend this meeting, but every effort will be made to allow the public to view and listen to the meeting in real time and participate when necessary. All votes taken by the Board of Health during remote meetings will be by roll call vote. For the public, if you're calling in on a phone, you can press *9 to request to speak. If you're watching on a computer or device, there is a raised hand button that you can tap or press to request to speak. Please use either of these options during oral communications to be recognized to speak. The listing of matters on the agenda are those reasonably anticipated by the chair to be discussed at the meeting. Not all items listed may in fact be discussed, and other items listed may also be brought up for discussion to the extent permitted by law. The order of the agenda can be modified at the board's discretion. So with that said, let's introduce ourselves. This is not only helpful for each other, but it's helpful for our recording secretary to hear voices and know who's speaking. So I am Joe Rosa, member of the board. And let's see, let's do the board members first. Claudia.
Claudia Schweitzer, Vice Chair, Board of Health.
Kelly.
Kelly Highland, Board of Health member.
Don.
Don Ganem, Board of Health member.
Good. And then we'll go around my screen at least with Rachel.
Rachel Blau-Tiller, Assistant Director of Public Health.
Jake.
Jake Taylor, current food inspector for the city of Gloucester.
Kate.
Cunningham, Public Health Nurse.
And Bree.
Bree, Health Inspector.
And of course, we have Bobby Orlando, our trusty recording secretary. Then, and I hope that's everyone. The next item on the agenda is an opportunity for public oral communication. That's a chance for the public to speak for up to 3 minutes on an item that is not on the agenda. Is there anyone awaiting to speak?
I do not see any hands raised. I'll give it a second. And no.
Okay. The next item on the agenda is the approval of the minutes of May the 5th, 2022.
I make a motion that we approve the minutes of May, what was it? May
May
5th,
5th.
2022.
Is there a second?
Second.
Kelly seconds. Any discussion? The motion on the floor is to approve them as written. If there's no discussion, I vote yes. Claudia?
Yes.
Kelly?
Yes.
Don? Don, are you still there? Maybe not. We have 3 votes for, we can consider that motion passed, and Don abstaining. The next item on the agenda is committee reports. There are no committee reports at this time on this date. Moving on to new business.
Yes.
Sorry,
A little bit.
is that Don? Who was trying to speak just then?
Donald.
Don, are you still there? No, let's continue with the new business. Rachel, I don't know whether you were going to introduce Kate to to the Gloucester world?
Yes, I have been attempting to so far the last few weeks. Yes, so it's our honor to welcome Kate Cunningham to the department. Oh, looks like Don is back.
I have a feeling he may not realize that his,
Okay, I'll go ahead and mute him if he can unmute himself when the time comes.
Yeah.
Oh.
Can you hear me?
You're breaking up a bit, but yes, we hear you.
I'll be inside the hospital in a minute. I'm sorry, folks.
Okay,
That's all right. So anyway, Kate joins us from Ohio. She has very critical experience at the federal level, also as a NICU nurse. So you know she's comes to the position with a great character. She's a hard worker. It's been a pleasure to have her so far. This is our second week. Certainly it's been quite an education as someone new to Gloucester, but she has fit right in and has added a lot to the department so far. So welcome, Kate. Do you want to say anything to introduce yourself?
I'm not terribly great at talking about myself, but I'm very, very happy to be here and I'm excited to get started and I can't wait to get to know everybody.
that's terrific, Kate. We
Welcome.
only hear good things, so welcome.
And Kate, feel free to reach out to me. I held that position prior, so if you have any questions or things, I'm happy to help you.
I would love to set up a lunch date because there's
Yes.
a lot to talk about.
Good. Yep, I'm available.
perfect, perfect.
Terrific. Next, Rachel, there's another introduction for us.
Yes, we have quite a new team here at the health department. I'd also like to welcome and introduce Jacob Taylor, who is our new health inspector. He'll be focusing mostly on the food side of things in terms of health inspections. And this was his first week, so we're 4 days in. There's a lot to learn, but Jake has been also a great fit so far. And I have every confidence that's how it's going to continue to be. During the interview process, we had multiple people approach us to give their unsolicited recommendation on Jake as a worker. So we're pleased to have him part of the team and we're excited to move forward with so many new faces in the department. Welcome, Jake. If you want to say anything, you're welcome to.
Hello, City of Gloucester and all our new happy board member friends. No, very excited to be a part of the team and I've been trying for this position for a number of years, so I'm very excited and I want to thank everybody and thank you very much.
Great, welcome.
Welcome.
Thank you, thank you.
The next item under new business is the Board of Health response to gun violence. Kelly, were you going to take that?
Yeah,
on?
I mean, I don't have a lot prepared, but I guess being in response to the recent shootings, I mean, there was another one yesterday at a hospital. So
Hi, Eric. Sorry.
I would like to, suggest the Board of Health to write a
Absolutely.
letter to, the public in response to the recent gun violence that we've been enduring for far too long.
Kelly, sorry.
Yeah.
Sorry to interrupt you in the middle of something, but Eric just called me and he apparently can't log on. So Rachel, could you send him the link again, please?
Yeah, I texted him a few minutes ago to say, are you coming to the meeting? So,
Okay, he's apparently trying to, but he can't get on, but I don't know why he can't, but if you can send it to him again, that might be helpful.
Absolutely. I will have Lee resend that invitation right now.
Good. Kelly, sorry.
That's all right. Yeah, so I think, and I'm happy to start drafting a letter and would like input from other board members and be able to offer the community resources. Gun violence is a public health issue. Any type of violence and injury prevention and all of that. So, I think it's important for the Board of Health to issue a statement and then be able to connect folks to needed resources. and other like action steps that folks can do. I was also at the Flag Rising gun violence awareness event today as well. And John Rosenthal, I mean, I wish I could have recorded the whole thing of what he's
Exactly.
done for moving the needle on gun violence and prevention measures. It was really a moving talk that he did. So, you know, he has his organization, and then there's a lot of other ones that were mentioned at the event today as well that we can offer folks. But, you know, I think it is something that we should just issue a statement on, and then also the intersection of like structural racism as well, and how the inequities of gun violence affect our Black communities as well. So I think that is an important piece to weave into any kind of statement that we do issue. So
can I just, I guess I'm wondering about thoughts about where this letter would go out to, because I think one of the problems that not just us, but I think in the whole city is, how do you get the word out about things? You know, like it used to be the newspaper, but we were talking to the mayor yesterday, and he was saying 4,000 subscribers to the newspaper, you know, out of 30,000 people. So that's one way. Facebook is another, but you know, and people say, well, just put it on the website, but I don't know how many people look at our website. So also maybe to be strategic and thinking about how we get it out, or to who or where, or
right, yeah, and I agree with that. I think the city still has the contract with John Guilfoyle's public relations firm. So we could see if there was, and I think probably the health department has some piece of that too, to be able to issue statements and press releases and whatnot. So we can push it out that way, and that they push it out to the bigger newspapers, the Boston Globe and things like that too. And, you know, so if the health department too wanted to issue anything, I mean.
We do indeed have access to the Guilfoyle public relations firm. And if the board wanted to prepare something, I'd be happy to facilitate handing that off to them or to Pan Toby, communications director, and the appropriate parties.
Sure, I certainly agree with the sentiment, and I think it's an important face for the board to have to present our opinion on these issues.
So I can start drafting something and send it along.
Good. Any other comments on that? No?
I think.
Oh, sorry.
Oh, no, just in that letterhead and everything with the condolences through the city and everything along those lines, I think should be suicide prevention numbers. And as you spoke, you know,
Yep.
suicide prevention, gun violence, you know, if you're depressed, you know, there's all sorts of different hotlines and everything to call. So different links towards those.
Good point.
Great, thank you.
I just want to say, Eric just texted me saying, could we send the link? So I just sent him the link again that that I had, but did Lee send him the link?
I did, she did, and I did as well. So he should have a brand new,
Yeah.
I see him in the audience. I'm going to promote into a panelist right now, actually.
Oh, great. So then he actually did get it.
Rachel, you have me back in?
Yeah, I don't think you went anywhere.
Okay, good. I didn't. I could hear you guys the entire time, and just for the record, I approved the minutes. It just wasn't going through. I apologize for the technical connection, but all right, thank you.
No worries. And I do see Eric now. Eric, welcome.
Eric,
Sorry about that.
Eric, welcome. So everybody who wants to here is here now. Is that correct? All right. So I think we left the gun violence thing that Kelly, you would draft something, and if you want to, certainly if you want to send it around for other comments or whatever, that's fine with me.
Yeah. Thanks, Kelly.
Yes, thank you. Any other comments on that issue? No? Let's move on to the next item, which is body art regulations. And I believe Bree was going to help us through that.
I'll hand this off to Bree in a second. Just some background, we did have a resident stop in inquiring about microblading. Fortunately, Bree comes from the Newton Health Department, and so she can offer some context on what the standard operating procedure for other municipalities have been. So Bree, I trust her knowledge of this, and if you want to just give us an overview of what some of the possibilities are in terms of adopting additional body art regs.
No problem. So luckily we already have body art regulations here, so really nothing needs to change so much as far as that goes. There's a few things you could do. So Newton was one of those weird places where they had a extra requirement for their practitioners, where they required them to work under a licensed medical professional. Now, that didn't mean that they had to be on site at all times while doing the microblading procedure or any permanent makeup procedure, but they did need to have someone that the client could go to in case there was an emergency or they were having a reaction of some sort. I don't necessarily agree that that's necessary. It was just an added thing that they required at the end of the day. It made it a little harder for people to get a permit because they had to find a doctor that was willing, or a nurse practitioner, someone that was licensed that would be willing to take that on. So that was just an added thing that they had to do. So there's a few things you could do with that. You could just add permanent makeup under the general tattooing definition in the current regulations and leave it at that, or we could add in actual additional definitions for cosmetic tattooing, microblading, permanent makeup, a permanent makeup practitioner, a few things you could do with that. But everything else really stays the same as far as requirements go for the room, for requiring a hand sync, just the same as tattoo artists. The only other thing to think about is what kind of, like, if you wanted any specific training for someone doing permanent makeup. And from what I had seen, a lot of the classes in like the surrounding areas, most of them are 100-hour certification classes. So pretty standard for majority of them.
So is that, sorry, Bree, is that in addition to the standard tattooing certification?
So that's including the CPR and bloodborne pathogen certification. This would be separate. So like tattoo artists need to have, worked under, or mentored, or, whatever their training is. It's kind of, it wouldn't be on top of that because they're not, the microbladers aren't tattoo artists as well. They're just doing the eyebrow microblading. That's it. As far as permanent makeup, they're not also doing tattooing.
Right.
No.
So the 100 hours would be
Just specifically for microblading.
Okay.
Yep.
I know the Beverly and like Salem and Peabody
Mhm.
we're doing a lot of this work, the public health nurses there. So I would suggest reaching out to them to
Okay.
see what they've come up against and to try to stay consistent with any regulations that those boards have passed.
Okay.
Because I think there was a lot of talk about in terms of the training and how there was none available in Massachusetts. So it was like hard to accept some from like California. I don't know. There was a lot
Yeah.
of like issues around the training piece of it.
Mhm.
And so I think the state has suggested a couple of trainings that would be eligible
Okay.
for folks that are looking to do it and get licensed in
Mhm.
Massachusetts. So it might be a helpful place to start.
Yeah, this resident doesn't have any training yet, so she's just waiting to hear from us on, before she does a training, she wants to make sure she's doing the right training. So she's waiting until a decision's made.
Mhm.
Right. Well, I would certainly concur with Kelly's suggestion that we find out if it's at all feasible to find out what's going on in the surrounding communities. Beverly is usually pretty forthcoming with what they've done. And so, Beverly, you mentioned some other communities, Kelly.
Yes, Salem and Peabody as well. I know Salem has had a lot of this.
Okay.
So I'm happy to send you their contact info.
Okay, yeah.
Thank you, Bree, for
Thank you.
getting this started.
Yeah, no problem.
Exactly. Anything more on this issue? So I guess we'll wait to hear at next meeting something more definitive, perhaps, that incorporates what we know about what's going on in the surrounding communities. Hopefully, the resident who's inquiring will not be encumbered by a month's delay. But I think passing on the information that Rachel, I believe you were saying that the state is looking into, or maybe it was Kelly, the state is looking into who's going to offer the training. I think that's an important piece that we probably can't really help with, but maybe we can provide some information to people desiring training. Anything else? No? Let's move on to,
That's it.
sorry?
I just said that's it.
Okay, good. The interview committee for the impossible job of replacing Max as director of the public health department. I believe all the board members know that the two individuals on the board that will do the initial interviews are Claudia and Kelly. They've at least one other person will join them, and that's Jill Cahill, the CAO in the administration, and perhaps Holly from HR, and perhaps another community member. But the important people are Claudia and Kelly, to be joined by Jill. The process will be for board members following as we've done in the past. As resumes, CVs come in, they will be distributed to all the board members individually, and board members will go through them, and each board member will highlight who they think ought to be interviewed. They can rank order them, and they can say that only one person is viable, whatever your particular way of evaluating the applications based on pieces of paper are. And all that information will be passed on to Kelly and Claudia, who will then decide who to interview. And the HR department will set up interview schedules. And for the first round of interviews, Claudia and Kelly and whoever is associated with the interview process will perform those interviews. Hopefully that will narrow things down to a much smaller number who will be invited back for second interviews that the entire board will participate in. I hope I got that correct.
Yeah, maybe, so just to add, I think there's one more week till till the closing.
Right.
So, hopefully, we haven't gotten a lot of resumes yet, a lot of CVs, but we're hoping that by next week we will have more, a bigger pool. And yeah, the second interview was a public meeting. It's a regular meeting where all the board members are there and any community people, and encouraging as much input is possible. Holly
Yeah.
doesn't usually come, just for clarification, Holly doesn't usually come to the first,
Ah, right,
but if she
good point.
wants to, that's fine.
So any questions or clarifications or issues? No, it's just, nothing has really happened yet apart from the posting. So we're basically awaiting CVs to come into the office. If there's nothing else on that topic, let's move on to old business. Strategic planning. We've just begun thinking about that at Kelly's instigation. I don't know if there's anything in particular to report. Is there, does anyone have a, Kelly, do you want to say anything about that? Or do you know what's going on? Or is anyone making any progress on that? Eric?
Nothing I'm aware of.
I just have a comment about
Yeah.
strategic plan. I called my previous board to find out what they have for their strategic plan for the board and for the health department, and it turns out that they don't have one.
Yeah,
And
that's the case in many.
And then I called a local, I checked with another local Board of Health, and they don't have one either.
Right.
And,
I think that's the case in many situations, but I actually agree with Kelly that it's useful exercise to go through to lay out our guiding principles. And to me, for instance, that means working towards health equity in the community is an important thing that ought to be stated to the community. If we don't have a strategic plan, it becomes very much more difficult to lay out to the community what our guiding principles are. And I think it's useful to have those written down so that people see what we're all about. The strategic plan isn't like a business plan. It's meant to highlight, one, as I mentioned, our guiding principles, and then highlight what we're doing well and what we want to continue to do well, and what we can do better at, what we want to add. I think those are, having them written down is just the final product. The exercise of coming to something that can be written down and agreed to by everyone is a useful exercise for the board, because I'm sure there will be differences of opinion and new ideas that we have a bunch of new board members. It'll be useful to get those thoughts discussed. And so I think, yes, you're correct, Eric, that most boards of health don't have a strategic plan. I think
But we did have one. We
did
have
have one, exactly. We should
Yeah,
have.
it just has to be updated and reviewed, but it's not,
Exactly.
we did.
I just, the reason that I checked with other ones was just to see if there was something we could use,
Oh, absolute, good
you know,
idea.
to help us. And I so far haven't been able to find one. The other thing I want to try to understand is, are we going to, I know it's for the community, but I just went through doing a year-long strategic plan. And it had goals and it had use for the people that did the strategic plan. And I want to make clear that it should be something that's a living document that we actually use ourselves and look at, you know, to have some goals for ourselves. Otherwise, it's just a piece of paper.
Sure.
It needs to be looked at frequently to see if we're doing what we're supposed to be doing.
Yeah,
I
and I think, you know, we also talked about the new director having an important role in framing and shaping the strategic plan as well as the board. So that in and of itself is a process, since we are looking for a new director. And then that was part of the motivation for Max saying, you know, it was time for him to go, because he didn't want to be involved in setting, you know, a strategic plan, and when, if he wasn't going to be there to be the one carrying it out.
For
So,
sure.
which I think makes a lot of sense.
Yeah, I'm also wondering if like every kind of piece of the department, like puts forth some of goals that they have individually that we would incorporate into the strategic plan, because I think, you know, we can't, you know, there's interests that lie, like I know when I was a public health nurse, it was maternal health, but
Yep.
Kate could be completely different and have no interest in that and really interest in emergency preparedness, like, you know, so kind of having those goals too. And then because public health is so, it's like everything, it gives us that direction and kind of like that organized process. You know, not to say, you know, obviously we get things thrown at us every day that take us off our daily, what we thought the day was going to be like. But it will kind of bring us back to kind of center and really looking at what our goals are as a health department and board of health. And again, like you said, Joe, like incorporating, you know, letting the community know what our goals are and getting feedback and input from them as well. I mean, that's who we're here to serve. So, so I don't know if we kind of want to just start with the process of having, you know, staff write down some things they're interested in and that are, you know, evidence-based types of interventions or things like that, that we can then work off of. But I think underlying some of those guiding principles like health equity and is also an important step. So I just don't know.
Yeah, I think we should reserve the deep discussions to await a new
For a
director
director, yeah.
participate, but it shouldn't prevent us from writing down some ideas that we see as being important, and we can have it on the agenda, you know, every month, and just and exchange those ideas and ultimately get to the point with a director in place of actually putting something together as a final document.
I'd be
We
happy
like
to.
the idea of having it on the agenda every month. So it keeps it in front and center, and as
Yep.
staff have ideas that they want to write down or send a memo that, you know, we can look at the board meeting.
Yeah,
I think that's great, but that is just what you're saying, Eric. It makes it a living document, and it's always in process. It's not some stationary thing that gets written and stuck in a drawer, you know.
yeah. So we don't have at this point, and I think it's really good that we don't have any format that people have to adhere to. So I would encourage you, Rachel, and Max as well, to go to the various people in the department and have them think about what they'd like to see in a plan that lays out, one, the guiding principles and what members of the department would like to see the department do in the future. What
I
they're
was
doing,
going to say,
etc.
I'd be happy to facilitate that. I've mentioned before, but part of my graduate work was envisioning. So yeah, I'm happy to play as much of a supportive role as you would like.
Good.
And I will absolutely organize some thoughts from different portions of our team.
Good.
Me coming onto the team and everything like that, being a new member, I'd like to get a copy of what the previous plan was that you guys or the old Board of Health developed and whatnot, just to sort of see what kind of aspirations and everything everybody held before. And as you were saying, Kelly, you know, trying to find individual members to figure out what they want to do, being new onto the health department and whatnot, you know, it might just be easier for some of us newer members just to sort of see what the overall picture was in the past, opposed to just sort of jumping into it head first without not really knowing what we're looking into, if you understand.
Good point.
Rachel, maybe you can, that was, we had that in our packet a couple of board meetings ago.
Yeah,
So maybe you could just
Yeah.
pass that out to the,
I will. Yeah, I will pass that out, and I will brainstorm a more formal way to approach soliciting ideas from folks in line with some of the visioning literature that I'm familiar with.
Good.
I know I was also looking forward to the upcoming community assessment results, and I think there's going to be a meeting on that soon, because I may have various different interests, but I also really want to know what the community needs most and focus on that. So having that information would be very helpful.
Great.
yeah,
Good.
good point.
Okay. What's next on the agenda? The BioBot reporting. Update.
Yes, following the previous board meeting on May 5th, we did send a memo, which is in your packet, to the administration. We have yet to get a response from the administration on that memo. This is something that I do think it would be valuable to hear from Kate on, now that she's on the team, and get her input on whether or not she thinks that the more extended use of BioBot reporting would be useful or not in the community.
So speaking very specifically just on COVID at the moment, I feel like BioBot could be really, really useful going forward in that moving to endemic stage, because it's much more generalized. It gives you a picture of what's going on with the community without necessarily focusing on every single individual, because we're starting to get to a point where it's not a sustainable thing to focus on each and every individual. That BioBot testing kind of tells you, okay, we have COVID circulating in the community at what level, and then you can compare that with your hospitalizations, with the reports that you're getting, and see if they're linking up and see what those impacts are. And the really great thing about the BioBot is that you have all of these people who also aren't testing, or they're just doing at-home tests that aren't getting reporting. So it kind of shows you how big the gap is. And then when you compare it with your hospitalizations and how often people are being seen, it shows you the severity of your COVID based on how much is circulating. And I think that's probably the best way going forward into that endemic stage, to see what the new normal is going to look like. Because if you think about flu, you have a regular amount of flu that circulates every year, but you have to kind of monitor those numbers over time to determine, is this going to be a very bad flu season? Like, is this unusual for us? So if we stop monitoring, we don't actually know the next time we have a COVID upswing of, you know, is this normal for us, or is this something that's extra concerning that we need to produce extra guidance on or come up with extra suggestions for? I think that could also be super helpful with other things that BioBot monitors, but I need to do a little bit more research on all the different things that BioBot is capable of, because I know that they had some research studies that suggested that 94% of the diseases that they looked at could be tracked through wastewater. And you could show those trends over time, and you could show what's normal and what's a spike. So from an epidemiology perspective, that's amazing. But it would require a little bit more research into what the actual capabilities are, how it works, and how well that protects the privacy of the community while still providing that valuable information.
Kate, I think the board is, thank you for that, first of all, that your perspective is very valuable. I think the board is in agreement of the usefulness of continuing COVID monitoring. The other piece of the discussion, just for background, and I know that you were on the BioBot webinar recently, is the possibility of monitoring levels of fentanyl, cocaine, methamphetamines, and nicotine in wastewater. And that was something that we were hoping to continue to investigate. What we last left it, that we wanted to reach out to local community partners and other municipalities who may or may not be using this data. So if you have any thoughts on that, I think your perspective would also be valuable. We did hear back from BioBot saying that they cannot release the information in terms of which communities are using the that particular service. So we don't have any more information on that end.
I definitely think that monitoring something like that with BioBot would actually also be very useful, because that is, drug use is massively underreported. So if you really want to know kind of the scope of what's going on and whether or not you're reaching everybody, that would be a very good way of not targeting any specific person or any specific neighborhood, but knowing like the overall scope of, okay, what's going on? Are we seeing the number of people in, you know, treatment centers or in hospitals or wherever, that the numbers are reflecting is our current problem. So I would say that BioBot is very useful for measuring your interventions and how well they're working. Because if you do an intervention and you see, okay, the wastewater, you know, numbers are showing that the levels of fentanyl in the community are going down, then something we're doing is working. Or if we have introduced an intervention and they're staying the same or they're going up, we know something else is going on, and we can address that from that broader community spectrum without specifically targeting individual people. And, you know, we work in public health. Everything we do is at a community level. So I think that could be very, very valuable. But that also depends on how long you want to monitor things for and how you use the information.
Thank you.
I think we also, though, had talked about checking with community partners like the North Shore Health Project, and other agencies that are working with substance abuse, to see what their thoughts were. Because I know, Kelly, you had some strong feelings about not doing it. And,
Yeah,
we were saying we wanted to get a broader perspective.
Yeah, I think it just needs to be a lot more strategic than just throwing it out there. Like, I think we need to really be more collaborative with our approach in working with our community organizations, really see if they feel, the ones that are doing the boots on the ground work, working with folks with substance use disorder, if this would be helpful. Because yes, there's interventions we could do, but do we have the capacity within the health department right now to implement any interventions that we see, or in a year from now? Do those things align with our prevention unit goals and grants? I know they're not, it's more primary prevention that what they're working on. So I think it has to be a lot more of a thoughtful approach to doing it, to doing that work and getting that information. Because I just, yeah.
My question is, with the BioBots and going through the wastewater and everything, how much does the community know about that and whatnot, and how much of that's being released to the community as far as that goes?
The COVID numbers, go ahead.
Weekly COVID numbers are on the website.
Oh, no, I understand about the COVID numbers and everything, but as far as the nicotine, the fentanyl and everything like that going through the wastewater and whatnot, has any of that information been released to the community or anything along those lines?
Well, we don't have any of that data
Oh,
yet,
okay, excuse me.
but
Okay,
we're told by
Jumped ahead of stuff.
We're discussing the possibility of
Oh,
getting
yes, ma'am.
of
No, I get you.
whether it would be helpful to add that, and it's also an added cost.
Well, okay, yeah, stepping forward then a step or two, as we talked about previous, releasing information to the community as far as the different steps and whatnot, that'd be another aspect to have to think about if you're gonna move forward with that program and whatnot.
Yeah, the brief legal counsel we've received is that because it would be community level data and not individuals, that it would have to be released to the community at large. It would behave just like the COVID data is behaving.
Okay.
What my brief review of some literature on this topic, one did identify that if you look more closely to approach the individual level, like on, for instance, college campuses often will both for drugs and COVID as well, will open manhole covers next to a particular dormitory and find out whether or not there's problems in that dormitory. And to the extent that that happens in a community, that can, in the literature I've looked at, can raise problems. I think Kelly is absolutely right that as you refine things down closer to the individual or a neighborhood, there are certainly problems that can arise. I personally would not be in favor of doing that in Gloucester, particularly not at this point, because at this point, I don't know what the nature of the data would look like, how sensitive it is, how reproducible it is in general. So if we were to do anything, I wouldn't go beyond doing basically a pilot experiment. But the one other thing that I did learn is that these kinds of analyses, and I don't know whether BioBot does this in particular, but these kinds of analyses of wastewater can identify adulterants in drugs of abuse. And that can be very useful to the community to put out alerts to people that are users that to be especially cautious that we're detecting, levels of whatever it is that can kill you.
Fentanyl, more fentanyl.
Yeah. And so I think
Especially now.
that's an additional level of information that might prove to be very useful. Other comments?
Is it possible when doing these contracts to specify where testing is drawn from? Because if that was a concern of like specifically being close to certain buildings or certain neighborhoods, could it be specified in the contract? We will only draw wastewater from these select areas that cover the community and not a specifically targeted.
Right. Well, it's up to us where we draw the water. That's where we draw the samples from. And to date, for instance, the COVID analyses are all just before the sewerage goes into the treatment plant. So it is an aggregate of the entire, whoever is on sewer in Gloucester. And certainly that's what, at least in a pilot program, would be exactly the same sampling point for other agents. At least that's my opinion.
And I think, as we talked about last time, I don't think we'd want to target a specific neighborhood.
Right.
Or because that.
It would be anonymous.
Yes. So if you do it at the level of entry into the
Yeah.
treatment plant, that's the whole community, basically.
Yeah.
That's
Right.
I guess the thing that I agree with Kelly too, that unless we have some way of using the data, I do see one possibility. If all of a sudden you get a big increase in fentanyl, at least the police will know that it's around town and be on the lookout for a lot of really bad problems. Because fentanyl can really kill people.
Yeah, no, exactly. But I don't know whether or not, maybe Rachel, you remember this, whether or not fentanyl is sufficiently stable to survive in the sewerage long enough. So one of the advantages of analyzing things closer to the source is that it spends less time in sewerage, and if it's unstable, it can degrade. Whereas it might not degrade if you're analyzing it outside a dormitory, for instance.
I don't have a definitive answer on that, but I would not imagine that it degrades so quickly based on my understanding of
Okay. So
mechanics of it.
that would be a possibility, I guess, of just analyzing something like fentanyl at the sewage treatment plant.
But I also just wanted to point out though, that the police are pretty savvy. And when there start to be fentanyl overdoses, that spreads pretty quickly. It just,
Sure.
and the word goes out, and you know, the use of Narcan goes up, and so I mean, I think there may be ways that it can be helpful, but in like the very short term, because if it takes a week, we get the BioBot once a week, you know. On Tuesday, fentanyl, you know, some drugs could come into the city and spread really quickly with fentanyl, and by the end of the day, the police will know. Have a sense. They won't know who, but you know, the BioBot wouldn't say that anyway. So I think in terms of it, again, figuring out how, if we do it, what would the purpose be, and how would the data be used?
I just would like to add that there are a certain amount of overdoses that are treated with Narcan among friends, which is something the police would be unaware of in most cases, and the hospital would be unaware of in most cases. So in my view, the advantage of BioBot is that it captures that as well, and relying on indirect data has its vulnerabilities and its faults. So it's something to consider, but I agree with Kelly that strategy is of utmost importance in this scenario.
And to speak again on just the general usefulness of continuous data, again, coming from a medical background, you're taking vitals all the time, not just when a patient has a problem, so that you know what's normal for them, and then you know, okay, this blood pressure is not normal for you. It may be, you know, within clinical range, but it's not normal for you, so something is going on. So there is a lot of benefit from an epidemiological perspective of having continuous data and knowing what your trends are and knowing what's normal and what isn't.
Right.
Good point.
So Rachel, where are we at? We've sent this letter off to the administration, and that was what was proposed in that letter. I can't remember. To continue the COVID analyses. Anything else?
Continued COVID analyses and further investigation on the usefulness of any extended use of that BioBot. So I think the next step would be to reach out to community partners, as we have mentioned before. I know that Max, as you guys have seen, the email has reached out to other municipalities, and we hit a dead end there. So if we wanted some community input, that would be the next step.
Well, I think that would be useful, and probably with the defining what it is we're considering here. No localized neighborhood testing, the possibility of tracking fentanyl, and whatever else was in that list, I suppose. We probably wouldn't do all of those things. At least I can't imagine we would. It might be worth posing to people what the possibilities are, and getting some feedback as to what others in the community, caregivers in the community, think would be most useful.
Would you like me to facilitate that communication, or would the board like to reach out directly to community partners?
I wouldn't know who to communicate with. So if you can organize that, perhaps together with Kate,
Okay.
other members may want to participate. Kelly, I don't know whether you can.
I'm happy to. And same with like even reaching out to DPH, like our Office of HIV/AIDS.
Yeah.
You know, Emily Levine is there. She does a lot of SUD work. So
Excellent. So Kelly, I will be in contact, and we can work together with Kate to make a list of community partners that are appropriate to include in this conversation.
sounds good.
Thanks.
Good. Next item on the agenda is the COVID-19 responses or data, whatever updates we have.
Yeah. So we did have a lapse in BioBot reporting because test kits were unavailable for several weeks, but we did get that resolved, and going forward, we don't expect any further issues. The current cases, let me just pull that up. We have 11 new cases as of today, 14 active cases, 1 new death. As far as other updates in terms of the COVID response, the biggest thing is that we are moving away from a contact tracing model, meaning that up until June 17th, we will have the support of a contact tracer who will call someone if they have a positive PCR, do some COVID education about best practices, and then also notify close contacts. The state has recommended that it is appropriate to move away from that model, and what we'll be doing is providing best practices publicly available on the website, and also doing more specific contact tracing for clusters and vulnerable populations such as early childhood and elderly community. So Kate has been involved in that and will continue to be involved in creating a model for more endemic stage management versus the model that we've been operating on so far. So that's happening as of June 17th. That's the last day that we have a budget for a contact tracer as a role in the department.
And I would just like to make a suggestion that there be more of an education campaign about individuals doing their own contact tracing, because so many people that I know, including myself, have had COVID recently through a home test. Those numbers never get reflected. And I know personally, I did my own contact tracing. I called the people I had been in contact with, and, let them know. And I think everybody needs to do that on their own. And even if we had contact tracers, that wouldn't come up. So I don't think that many people are going and getting the PCR test because they can just do it at home. And I don't know how reliable the home test is. What I understand is if you test positive, then you're definitely positive. But if you're negative, you may be negative, you may not. But that seems to me what people are doing. And so I think there really needs to be a lot more education in the community about that.
Is there a way to, so I'm just thinking of when North Shore Community Health handed out our test kits to community members, we would put educational materials in 3 languages with it. And so I know there's a variety of places folks can purchase or, get insurance, whatever, for the test kits. So I didn't know if there's a way with our local pharmacies that we could have some sort of thing stapled to it. Because I know I had like CVS put together I went and did like a pickup, and so it was like all stapled together, the bag and everything. And if there was a way to have information stapled to the bag, I don't know. I mean, I tried that with Narcan, and that was a lost cause, but suggesting that way.
Mm-hmm. Yeah, or even if they would let, something on the counter and the pharmacy counter, flyers that gave the information that people could pick up. Because I know if you're on Medicare, you get 10 free kits a month, and you go to the pharmacist and they write a script and then they give it to you. Mm-hmm. So that's a lot of older people are doing it that way.
We haven't quite ironed out exactly how we're going to approach it yet, but that's going to be a huge part of it, is community outreach and more of that general education, instead of contacting each person by each person and saying, this is everything that you need to do, and here's everyone you've ever talked to.
Right.
It's going to be much more of a general, you have the tools, and then here are the steps that you follow. Please reach out to the people you've been around, kind of a responsible stewardship of COVID infection, if that makes sense.
Yeah.
Yeah.
But
no,
just
I think those
to
are
give
good.
a shout out to the department, unfortunately, a close friend of mine tested positive yesterday, and he did have a PCR test, and because he had a lot of symptoms and he was testing negative on the home test. So his doc, and he said the contact tracer called and spent a lot of time with him, and it was very helpful and gave him valuable information, and it really helped. So yay, that was good to hear.
Yeah, our contact tracing does fantastic work.
Yeah.
Is there no room for like ARPA funds? What, do we have any requests for ARPA funds from the department to the administration for things, or?
That's a great question. They're currently hosting listening sessions. The administration is about ARPA funds. It's my understanding that much of it's going to the wastewater treatment plant because it's primarily for infrastructure. That's certainly something I'd be willing to advocate for on behalf of the board if we wanted to go in that direction. But at this point, for at least this fiscal year and the coming months, we do not have any other funding to fund contract tracers.
So
Yeah,
I don't
I
know,
just-
Joe, if you want to say something or you
I
want
mean,
me to.
at the meeting that Claudia and I were at with the mayor yesterday, it was mentioned that the administration will gladly accept proposals from the health department. At the moment, it doesn't have any. And so no guarantee of support, of course, because all the proposals are being accumulated now, but we shouldn't be left out. So if there are good proposals to be made, by all means, get your voice in front of that.
We should
those-
be first in line with our hands out because we we
Yeah,
were the ones with doing the pandemic. So I
Yeah.
feel like, you know, we should be ahead of DPW, fire, police, like really the health department should be putting their hands out.
But
Right.
it seemed like what we're hearing is that there's certain groups, who yell the loudest,
Yeah,
go to all the
right.
meetings and get it, but they said really, they haven't heard from the health department and they really want to.
Yeah.
I threw out some ideas about, mental health, prevention, the prevention team doing more mental health, whatever. And that was just the top of our head, but I think it's really important for the staff to get together and come up.
Yeah, the next Zoom meetings that I have in my notes are June 9th and the following week, June 16th. Those are Zoom meetings. I believe they're at 6 p.m. You probably have to go on the city website to get details.
Yeah. It's a lot of money, $23 million, and they're really open to how it's being. So I think, Rachel, that's a fallacy that all of it's going, toward the wastewater
Right.
treatment plant.
I wasn't sure if it was the wastewater treatment plant specifically, but what I was told was that it was infrastructure focused. So, but that's great. I wasn't aware that they were open, looking for recommendations from us or requests from us.
Yeah, no, and when Claudia mentioned mental health, I've certainly supported that, and it was not dismissed out of hand at all by the administration. So things like that are certainly in bounds. And so, by all means, put together proposals. One of the things that, as we're thinking about the future, we were talking about COVID. One of the things I've read recently is because people have been masked up in the past year and avoiding other people to the best of their abilities, that our experience with flu has not happened this year. And so our immune system has not been sufficiently trained by the new strains. And when the new strains mutate yet again, they're even going to be further away from what our immune system is capable of dealing with. And so the upcoming flu season may be very bad. And so that's something that we should be thinking about in terms of beefing up our abilities to provide vaccination clinics for flu. Anyway.
I definitely agree in being proactive about that. Flu mutates
Sorry?
a little bit differently than COVID does, though. So I'm not quite sure it's going to be catastrophic, but there's also no necessarily way of predicting that.
No, exactly. No, it's not for sure, but I think it makes logical sense that we didn't have much of a flu season this year because people were masked up and or at least in the winter months, and kept their distance and basically didn't get exposed to the current variants of the flu, which means our immune system has now fallen back one step away from the antigens that are normally presented and mutate a bit in the next season. Now we're going to be essentially 2 seasons away. And so it's possible that a new flu variant may be more aggressive for that reason than otherwise. And so all I'm saying is that it's a good reason to increase our desire to vaccinate as many people as possible. Kate, I don't know whether you're familiar, but the health department provides a number of flu vaccine clinics around the city, which are very useful, vaccinating people that otherwise wouldn't be vaccinated. And I think that's all I'm saying is that that's likely to be even more important in the coming flu season.
Joe, it's even worse than you think, because this is not much flu this year, but last year there was almost no flu.
Yeah.
It was one of the lowest amount of flus on record, because we were even more masked last year. So we've actually got 2 years of not being in contact with flu. So this will be the 3rd year. The next year will be the 3rd year.
Yep.
So,
And now if COVID stays sort of simmering the way it is now, making people comfortable to wander around without masks and interact with people in football games and basketball games, etc. That's fertile ground for the flu.
yep.
So anyway, it was a bit of a diversion from what we were talking about, but I think it's something that we should be aware of.
I'll just chime in that I know several people right now who have the flu. I know about 5 people who over the last 2 weeks have been diagnosed with the flu. So
There was just a flu outbreak at a prom, actually.
Yeah.
people who thought they had COVID, but it turned out to be the flu.
Yeah.
Yeah.
Anything else on COVID? Let's turn to Rachel for the saga of the Good Harbor Creek pollution investigation. It sounds like a TV series.
It should be. It's interesting enough, at least in my opinion. Yeah, so as you may have seen in the memo I sent last night, we've been getting lots of information. It's been extremely eventful. Several weeks of field work. I've had the greatest pleasure of shadowing the engineers and taking a look at all of the different types of testing that we've been doing. So I'll just summarize very briefly. It's difficult to communicate such a great deal of information into a 2-page memo. So I hope that it was clear and concise enough for you all. But to summarize, we've been doing some dye testing, some cammering of sewer lines, bacteria sampling, infrastructure observations, and most importantly, we have a couple of abnormalities that were observed and also a couple of things that we were able to rule out. So for example, there was some question at one point if septic systems over off of Witham Street and Beechcroft Street were contributing to the problem. I can quite confidently say that we can roll that out at this point, which is great because it's one step closer to finding the actual cause. High levels of bacteria were observed in that area, but further DNA analysis revealed that it was likely due to animal activity because no human markers were observed in that area. Additionally, we've been doing some dry weather sampling at some of the points of interest on the other side of the creek. So surrounding the Neptune Place line, the Hart Street line. Typically, we've been finding very low levels of bacteria, which is good. It could indicate one of two things. Number one, that there is an issue, the issue was resolved. Number two, that the high amounts of bacteria are happening during wet weather. And that could likely be because a pipe is surcharging. If there's a perforation at the top of the pipe, the bacteria is only exiting the pipe through sewage during a rain event. And we did some data analysis, we being the engineers at Woodard and Curran, the biologists, and the longitudinal data that we've collected over the past year indicates that high levels of enterococci do indeed correlate with short duration heavy rainfall, indicating possible exfiltration of sewage pipe. So the only way to confirm that is to look at the pipe itself. We did look at 2 pipes. It's an extremely exciting process. I wish you all could have been there with me staring down into the manholes and watching on the TV as the camera went through the sewer pipe. The first one being the Neptune Place line, the cross-country line that goes from Neptune Place to Bass Ave. We were only able to make 150 feet of progress before obstructions within the line stalled us. And we would like to recommend to DPW to repair that pipe and that lining so that it's passable and so that we were able to observe the remaining approximately 650 feet. And then we did look at the Hart Street sewer line yesterday, and a couple things were observed. First of all, the line was surcharging pretty frequently, which is atypical for a line of that volume, meaning that it was at 100% capacity and flow. That means that if there are any compromised areas of that pipe, the sewage would be reaching that point. So if there's a perforation at the top and it's surcharging, then we would see exfiltration. And then we did observe infiltration in the pipe, roughly where the culvert is on Hart Street, if you guys know where that is. So there's footage of dripping coming down from the top. Whether or not this is the smoking gun, we don't know yet. I'm waiting for a report from a certified engineer to tell me the extent and the severity of this infiltration. But one thing we do know is that when we have infiltration, you have exfiltration, and it is a sewer line. So we're confident that there's some sewage leaking into the marsh system at that point in the infrastructure. Is it traveling to the footbridge? We won't know until we have more data to trend heavy rainfall and what the creek conditions actually look like. We're 2 weeks into beach testing. Both times the creek has tested within limits. So either, again, rainfall has not surcharged the pipe sufficiently to where it's impacting the creek yet, or the issue is unrelated to that perforation in the lining and could have already been resolved. So sorry, that was a lot of information. It's been a very exciting several weeks, and I'm happy to answer any questions.
I guess there was some in your memo, there was some comment about that it could be from animals. So what's the thought or theory about that?
Yeah, absolutely. So one of the points of interest in this investigation is the Marshland area, sort of in between Old Newgate Farms, Witham Street, and Beechcroft Road. There are 3 failing septic systems in that area. So it was thought at one point that this could be a potential pollution source, that these cesspools are essentially leaching into the marsh system, and that bacteria is traveling to the footbridge and proliferating there. We did observe all summer last summer extremely high levels of enterococci, and we did observe recently more high levels of enterococci in that marsh system on that specific part of the ecosystem. Now, what we found out because of some more in-depth DNA analysis is that that bacteria does not have any human DNA markers in it. So that means that probably the septic systems have nothing to do with this, and it could be animal activity in that area. Now, again, if that bacteria is actually making it to the creek. We don't know that. My assumption would be probably not, because that's 2.5 miles away from the point of testing for the DEP beach sampling. So I think that just happens to be a bacteria laden area. And that's probably because of bird activity or other animal activity, and is probably unlikely to be contributing to the pollution.
Oh, okay.
Is that clarifying?
Yeah, no, because I was imagining, how many animals or what, are there herds of coyotes or, what, if that was the cause, that it would have to be some huge amount,
Yeah.
of animal activity. And I was starting to have nightmares about envisioning what it could look like.
Well, I live on that marsh, and I can tell you there are definitely coyotes.
Yeah,
But,
no, I'm sure there are. They're everywhere in Lanesville too, but I mean, not to the degree that, it would affect that. So
Indeed.
thank you for
Yeah,
clarifying
and I
that.
think the other point to that, to the idea of animal activity being a major contributor here, is that we do have nearly 20 years of data for the Good Harbor Creek. And it would not necessarily make sense for animal activity to be the sole cause of this spike in bacteria after decades of occasional spikes, but never to the extent that we saw over and over and over again in the creek. So the patterns make more in line with an infrastructural type of aberration.
Thank you for clarifying that.
Yeah,
I can
absolutely.
sleep tonight.
What was that?
I can sleep tonight. Thank you.
Yes.
For clarifying.
I'm still curious. I'll be curious to see if it does have some relationship to the heavy rainfall we had last year, because we had a lot of rain last year, and I think it overflowed a lot of our sewer systems. So I'll be curious to see if that comes up with anything.
Based on the analysis, the answer is yes. We see a very clear correlation between heavy rainfall and these high levels of intercocci. So I don't think it's like a CSO or an SSO where the sewer system is just flowing into the beach like it does at some points during heavy rainfall at Pavilion, for example. That's a part of the infrastructure. That's a normal event in some cases. This is more likely if there's a perforation in the line and the line is reaching capacity because of rainfall, that perforation might be on the top and it's getting out because it's surcharging. But we do have evidence to support that there is a heavy correlation.
Rachel, do the contractors have an idea of when the final report will emerge?
We don't have a specific timeline. There are two things that impact how quickly this could be resolved. First of all, we do need more time to trend whether or not the issue has been, again, resolved. It very possibly could have been resolved during repairs. Hart Street, 30 feet of sewer pipe was replaced several months ago on Hart Street, which was a high point of interest for us in terms of high levels of bacteria. We don't know, and we won't know if that's contributing it until we look at the creek and its conditions for several more weeks at least. Now, Neptune Place, it's highly concerning to me and to the contractors that there's 650 feet of cross-country sewer line pipe that was put in 1947 that we cannot access. We have no image of, we have no footage of. So I would say that before this reaches a final conclusion, it's almost completely necessary to remediate whatever's going on with that pipe so that it's passable for the camera, so that our contractors or a third party is able to view it. So we'll need to work with DPW to get that taken care of. I don't think anybody would be comfortable saying, yes, this issue is resolved until we have eyes on that pipe.
Right.
Yep.
Any other comments on this saga?
Like I said, the saga continues.
Right, exactly. So the next item is pest control in the public schools. Is there an update on that?
Yes, I do see Marianne as an attendee, so thank you for hanging out. So the most recent update on the presence of pest control usage in the public school system is that I did reach out to Jill at the beginning of the month to request her support in communicating with DPW to get to the bottom of what has been implemented in terms of pest management in the schools, what is being implemented. Just as some background, I was unable to locate any contracts by speaking with representatives from DPW and from the school system and from contracts and purchasing. There seems to be some confusion about where that contract lives. And we do know that there is indeed, or at least has been in recent history, pest control happening at the schools. So at a previous board meeting, we decided it's time to get the administration involved to assist us in narrowing this down. I reached out to Jill, I did not hear a response. I reached out to her again and was not able to get a response a second time. And then I did have Max step in and take over communication, and we still have not heard back at this point.
This is not good. I will make that as my comment.
And didn't we also hear that somebody has a contract that the city pays some entity a couple of $100s a month?
Yes, that is
something. So the city, I mean, they need to know who they're paying, we need to know what it is they're paying for. But I mean,
yes.
they're paying this money out every month.
Legally, they're required to disclose that publicly. And I do see Marianne Boucher in attendance, and she has her hands raised, if that's okay with you, Joe.
Sure, by all means.
Marianne, you are online.
Thank you. Marianne Albert Boucher, 93 Mount Pleasant Avenue. As I stated the very first time that I spoke with you, which was in your office where you held your board meetings, this happened on April 23rd, 2021. We've gone past a year and a half now. My 5-year-old granddaughter picked up a rat box on the property of the East Gloucester Elementary School, had it in her hands, the big black rat box. The hole is large enough for even myself to put my hand in it. It's not like a maze when you open it up. It's like spikes, 5 spikes. It had the chemical, that particular one did not have the chemical, or I did not see the inside of that particular box. But it had the name of the chemical pest company. It had the chemical label on the top of it. I immediately actually screamed for her to put it down. I contacted our local mayor at the time, who had it removed within 10 minutes, thank goodness. Lo and behold, in September of the same year, walking behind the school again with my grandchildren, they live in the house next to the school. And lo and behold, we found another rat box. Same pest control company, same rat box. I went in and got the principal, who came out, notified Joe Lucido. Joe Lucido came over, opened up the rat box, took pictures of it, sent it to the mayor. The mayor contacted me and said, I think there's just newspaper inside. I said, no, those are bait bags. And this is my granddaughter, 5 years old. I have 3 grandchildren. I grew up next to that school. The playground, the East Gloucester playground, is next to the school or behind the school. There were kids behind that school morning, noon, and night. And those rat boxes are like a little treasure chest. And not only am I concerned about the children, I'm concerned about animals. I'm concerned about birds. I'm concerned about adult human, anybody. They do not belong there. I do not understand why this has gone on for a year and a half. And I've contacted the school committee. I've written to all of them. I had one school committee member get back to me and said she'll relay the message to other school committee members and the administration. Other than that, and Rachel and Max, thank you very much for all of your assistance and your help. But it just seems like this is going in circles. And I only care about the kids. I care about the kids and I care about the animals. And I'm begging all of you to make sure that not only are they removed and continue to be removed from East Gloucester School, but removed from all of our schools or any playgrounds that our children are at. I'm horrified to think that this has gone on this long and we have zero answers. I'm not trying to be a complainer. What I'm trying to do is prevent a child from being harmed. And you're the Board of Health, and I'm turning to you for your help in seeing that we follow through and prevent a child from being harmed. It is a toxic chemical. I have the pictures, I have video, and it is, 2 of them were there, and I have photos and videos of both of them. So I thank you, Rachel, very, very much for all of your hard work. And I thank you, Chairman Joe and the other people involved. But please, please, let's get this resolved. Thank you.
Thank you, Marianne. We hear you and we appreciate your concern. Please know we are not giving up on the issue. My recommendation would be to make a formal memo as a request to the mayor to become involved in the situation.
Yes, I would agree.
I can't even imagine. What if my little granddaughter had her hand, or just one of the children behind that school? What if they got into it and got injured? Then you've got a lawsuit on, the city's got a lawsuit on their hands. That's the last thing that I want to see for the city of Gloucester. And especially it's the last thing I want to see for a child in our city. So thank you. Too long. It's just been too long.
You may have more luck, contacting the mayor and the administration than we do. When it comes.
I actually went to the city hall last week and I asked them to specifically go to the last 2 Board of Health meetings to listen to what you've had to say. And I've received 0 response. And I'm frustrated because it's my granddaughter. It is children. And I am the biggest advocate in this city for the children. And especially for the chemical toxic dangers. I'm turning to the doctors here to ask for their advice and for their for them to speak up and speak out. Especially Eric, you're the pediatrician here. How do you feel about it? I'm really interested in hearing.
Mary, I'm on your side.
Thank you very much.
I've been complaining about this since you brought it up right from the beginning.
There's nothing more than I would just want to see them gone, resolved, and I want to see the notices inside every school that with the label of stating what the chemicals are at each one of our schools. We need to protect our kids. That's it. It's that simple.
Now, to clarify, I do believe the boxes have been removed. Is that correct? To your knowledge?
To my knowledge, at the East Gloucester Elementary School, but I'll be honest, I have not gone back since September. I think it was September 29th, 2021. I haven't gone searching for them. If I'm up there, I clean the schoolyard, not the school itself, lot itself, but the playground. I clean it once or twice, a month. And I haven't seen any in or around the playground, but I haven't really examined the school. I've really been depending on the DPW and our mayor, the Board of Health, and our administration to do that. I don't think it should be my job. I think it should be the job of everybody else. I've reported this several times and I'm exhausting all my avenues. I am so beyond disappointed that when it comes to our children, that we can't get resolution in this. So.
Well, Mary,
I would imagine if it's in East Gloucester, it's in all the schools. Why would it not be at Beaman or West Parish or Plum Cove? I mean, if it's that one.
I can't speak for that. I can only speak.
No, I understand that, but I'm just saying that,
I actually have in front of me what the the East Gloucester Elementary Outdoor Integrated Pest Management IPM plan is. And it seems like they updated it finally on, it says date recorded 11/16/2004 for indoor and outdoor, and it was updated on 9/20/21, and it lists the chemicals for that particular school. But I did not look, I'll be really honest with you, I did not look at the other schools, but I do have, I'm suspecting the same purchase orders that Rachel has. And it doesn't indicate where. It just says order for pest control, and the price was $800. And that was back 12/2/18. I've got another one for the preschool for January 24th, 2019. Oh, and let me see. One more, 7/15/2021. And it just says open PO for pest control. Gives the account number $500. You know, I'm not trying to get anybody in trouble. I just want my granddaughter and all the children that attend these, or East Gloucester School, I can't speak for any other. I just want them safe. And I want to know that when their school dismisses at 2:30, and you can't imagine the number of children that stay behind and play at that school 5 days a week. And there are some parents there, but there are a lot of children that are staying on their own. There are a lot of children that venture behind the school. I found one next to the back door. That was the first one. And the second one was found behind the school on school property. So I don't know. I've exhausted all my avenues. I just short of calling a lawyer and calling a television station, which is the last thing that I want to do. But I just want the kids safe. I just want the kids safe. That's all I care about. Thank you.
Marianne, I think the first step is to continue to confirm that this is not actively occurring in the schools. Second would be to follow up with the administration more formally with a memo to request their involvement, and I'd be happy to facilitate that.
Thank you. I would truly appreciate that, because I've gotten nowhere. But I thank you. And I
Thank you for
really
your-
depend on all of you. I really depend on all of you to help with that. So thank you.
Well, it sounds like there are two issues, Rachel. One is the specific one about these rat poison boxes, which may or may not be around other schools and are being sort of removed on an ad hoc basis. That's one issue that shouldn't exist. The other one is Eric has mentioned this from months ago, that by law, we're supposed to have updated integrated pest management systems. We're supposed to have a contract. We're supposed to make public what agents are being used when, and where is all that data?
It's supposed to be a paper trail. Every time they do any pest control in the school, they're supposed to give a sheet with what they used, where they used it, and it goes to each school and also to whoever is whoever integrates all of that in the school system. And as far as I can tell, I don't even know who the pest control operator is.
We don't
Yeah.
know who the they is.
I mean, do we even know who was
No.
doing the pest control? Rachel, do we know? Is there a name?
I do have POs. I don't recall off the top of my head, but I believe there was a company named.
All right. So if you send a memo off to the administration. I think it should, Jill and the mayor should be made aware of this issue. And it doesn't sound like it's anything that we as the Board of Health or the Health Department is going to be able to resolve, because this is an issue that has no responsible party, and people are just bouncing it around from one place to another, and it's not being addressed. I think someone like the mayor's office needs to have a come to Jesus moment where people assume some responsibility, and if there is no one responsible, to make someone responsible. And I think that can only come from higher up.
Absolutely. I will continue to communicate with the board in terms of a draft memo.
Good, thank you.
Rachel.
Are there any reports, director, assistant director reports, department reports?
A few brief line items.
Okay,
We've already done staff introductions.
good.
We did have one condemnation that Bree and I worked together on earlier in the month. It was a 30-day condemnation, not a 24-hour condemnation. And I believe the occupant is complying with remediation. We did have a budget and finance meeting concerning the Board of Health budget. And as far as our request for additional funding, everything was approved, such as the shingles vaccine, the money for hoarding cases, the $5,000 we've requested in assistance for folks who don't qualify for other support, and some staff raises.
Oh, great.
That is great. Additionally, we've had a bit of coverage in the Gloucester Daily Times. Max provided some information to the paper in regards to COVID-19. And there was an article on the Creek on 5/27 concerning the status of the pollution investigation. And I'm in active communication with Ethan Foreman from the Times as well. Additionally, Max and I did present at City Council a week and a half ago, and we gave an update. Max gave an update on the opt-out mosquito spraying option, and I presented on the Good Harbor Creek as an update. So, and we got great feedback, and it was a very productive conversation with the council. That's all I have. The dental center is more progress on shutting that down. The next step is letting the administration decide what they'd like to do with that space, but that's moving forward. And big shout out to Lee O'Leary and Diana Edgar Maloney for facilitating that process.
You know, I just as an aside, when you mentioned the dental center, it reminded me that that was one of the topics that possibly came up for Arbor for the funding that just happened to be kind of thrown out for the dental center, whether it's through the family, I just blocked on the Family Health Center, or through some other group, but how important it is, especially the pediatric dental piece, and
Well,
whether that funding they might be able to piggyback on that.
We do have Polish Dental coming in to replace the services that are being lost by closing the dental center.
So and that sounds great.
As far as we know, that's been working terrifically, right?
Yes,
And
they've been great.
is that likely to be without cost to us in perpetuity, or is that sort of a come on?
As far as I'm aware, that would be a question I'd have to clarify with the responsible parties.
And that's only in one school, right? So far. You know,
No.
what about, could that be citywide?
Around.
Yeah,
Yeah.
it's available
Oh,
to, let's see. I believe so. Yeah, it's available to students, all students.
Oh, okay. But they go into all the different schools?
I believe so. I'm just trying to confirm that. Yeah, we've received reports on we've received reports on from different schools with the school-age
Okay,
children in
okay.
general.
I thought it was just at veterans.
I believe so. If I'm wrong about that, I will send an email correction.
No, perfect.
Anything else, Rachel?
No, that's all on my end.
Concerns of the board?
Well, I'll just bring up, it's not really a concern, but it was mentioned when Joe and I had a meeting yesterday at the mayor's office about an in-person board meeting. There's now an opportunity for the board to meet in person at the harbor master's office with, so it'd be a hybrid meeting where the public could be on Zoom. It exists, the technology for us to be in person. And what the mayor was suggesting, we were discussing, was the fact that the more bonding takes place, among the board when we work together and see each other in person. And so just throwing that out there, whether that's something the board would like to try. Because we're a small enough group, I guess with the city council, they needed to be at the library because it was too big a group and it didn't work out well. But with 5 of us, they thought that would be a good venue.
Yeah, and it can accommodate a few more people.
And
So,
a few more, yeah, and a few more staff.
so do board members have any positive or negative comments about that?
Yeah, I agree with Claudia. I think that'd be great to get back in person meetings, and that's awful nice of them to make their offices available. So I look forward to, that would be great if we can do that, Joe.
Yep, good. Eric, what's your thought?
I would love to meet in person again.
Good, good. Kelly,
Same, yep. I'd be open to that.
good. So I forget who Greg told us was the scheduler for that. Leslie.
Somebody, and you call between 9 and 3 o'clock.
Maggie is telling me that it is someone named Leslie, and you have to call between 9 and 3 o'clock to make
So
sure.
Rachel, is that something that the department can do to set that up for our next board meeting?
Yeah,
Absolutely.
that would be terrific. All
And then,
right,
yeah.
anything else?
Nope.
Thank you all. Good to meet the new people.
Yeah, definitely. Welcome. Wonderful to
Well-
have you.
Everybody.
Yes. Motion
Ditto.
to adjourn.
Welcome,
Second.
Kate.
Do we have a motion to adjourn?
Motion to adjourn.
Second.
All in favor?
Aye.
Aye, aye.
Roll call.
So have a great trip. Oh,
Yes,
and
thank you.
John,
Yes,
you too.
Claudia's gonna be,
Thank
Maggie
you,
and I are
Claudia.
away
Thank you very much.
starting tomorrow until the 13th. And Claudia is gonna keep the boat afloat between now and then.
Okay,
All
all
right,
right.
all right.
Good month.
take care, everyone.
Night,
Thank you,
everyone.
everybody. Bye-bye.
Yeah, yeah.